All right, so I hope you all enjoyed lunch, and we'll now move on to our afternoon session for the day. And I'd like to welcome Dr. Dov Deegan, who's a general physician as well as a renal medicine physician at Eastern Health, and he's actually just started as a DPE at Maroondah. So congratulations on that appointment. He's also, like Dr. Jeff Toogood, a real advocate for mental health and for mental health amongst trainees. So we'd like to welcome him up, and he is going to explore the perception of mental illness in the medical community, how we can reduce the stigma of mental illness as we move forwards in our careers as well. Thanks, Doc.
Thanks so much. Can you hear okay? All good? So thanks for inviting me to this. I think that mental health is a really underrepresented but pretty important topic that isn't getting much traction, or not enough traction, I don't think. And so I like to speak out about my personal experiences, but also talk about what I think that we can do to improve the situation in the culture of medicine, both in registrar years, but also moving forward to consultancy. So my name's Dov, I'm the youngest of two. I was born and bred in Melbourne. In terms of career history, I did my medical studies at Monash and graduated in 2008, and eventually went on to subspecialise in general medicine, which I finished 2 years ago, and just finished nephrology midway through the year. I decided I needed 2 months off after that, and I strongly advocate for a holiday at the end if you can factor it in. I think professional burnout is very insidious, but happens to all of us, and we don't get looked after if that happens. No one's sort of going to raise the flag if you're feeling tired or stressed or burnt out. So I took a month off, and then the second month I went overseas independently, which was the best thing that I could have done. And then I started consultancy fresh a couple of months ago, as mentioned, at Eastern Health, and also as DPE there. I've got a lot more work-life balance now. The original topic of this talk was just about work-life balance for the advanced trainee, but I think that's a little bit boring. No offence to anyone. I think everyone would have gone to sleep with that. I wanted to personalise this topic a little bit more so that hopefully everyone will get something a little bit more out of it. But there is a lot more time on the other end, I will say. Particularly at the beginning, you don't start off full-time, and you don't expect to start off full-time. And you've got a lot more free time to rediscover long-lost passions, hobbies, things that you might have done before work and life got a bit crazy. And you'll have that for quite some time until things build up. So don't worry, like the pace that you're on during advanced training is not the same pace as the other end. So the reason this is personal for me is I also happen to have bipolar disorder, which is formerly known as manic depression. And I always mention this fact last in my sort of biography spiel, because I don't think that the label defines me as a person. And while I acknowledge my illness, I've accepted it, it's not who I am. It doesn't define me any more than, say, one of our patients who are diagnosed with hypertension or diabetes. So I find that when I first tell people about my diagnosis, they're generally quite surprised because I'm quite high functioning. I don't display any active symptoms of mental illness, and I'm doing very well. And I've lived with bipolar for 18 years now. And even though I've been affected by episodes of both the soaring heights of mania and also the soul-destroying lows, I've pretty much, for the most part, led a productive and balanced life. I was actually first hospitalised during medical school when I was at Monash, and despite that setback, I successfully completed my degree with honours. When I'm well, I'm high-functioning, I'm a successful individual. So for me, one of my imparting messages is that living with a mental illness does not mean I can't achieve my goals nor live a successful life. In 2015, I decided that I wanted to get involved with the mental health space for a number of reasons. I guess first and foremost, I wanted to demonstrate, like I've just said now, that it's possible to live with a mental health condition and still live a full and successful life despite challenges and setbacks. And I also wanted to speak out because I was tired of being ashamed of living with that stigma of having bipolar disorder. I see all these patients at work. I think to people with diabetes or ischemic heart disease need to be afraid of telling others their diagnosis. I also got to thinking, why is a sick day from work for anxiety or depression any less substantiated than having a migraine, for example? Both of those things are organic illnesses. They both affect the mind, and neither of them can be visualised. But unfortunately, in my experience, employees who experience mental illness are far less likely to receive the same level of encouragement and support as those suffering from a physical illness like cancer. And I think this is a form of discrimination, albeit in subtle disguise. I'm in quite a unique position as a mental health advocate because I've experienced both sides of the fence, as both an inpatient, but also as a medical practitioner. So when I speak strictly from the doctor's perspective, I'm disappointed by recurrent stereotypical and disparaging remarks that I've seen made flippantly by some of my medical colleagues about patients with psychiatric problems. I'm personally horrified when I witness how poorly patients with mental illness are treated when you compare them to those who are unaffected. As an example, which I'm sure most of you can relate to, psychiatric medications are often omitted from being prescribed on the drug chart, but none of us would ever intentionally forget to chart someone's insulin. And along that track, I think that language is very important when we have conversations about mental health. So phrases like, I'm a little bit OCD, really aren't helpful. And I hear that all the time. And OCD is a really debilitating illness for those people who actually know about it, who suffer from it. I've also noticed on my tracks during my career that there's a hierarchy of stigma that exists under the banner of mental illness. So there's a lot of work that's been done to destigmatise conditions like depression, anxiety through Beyond Blue and celebrities talking about their experiences with mental health. But mental illnesses with lower prevalence, like bipolar disorder, schizophrenia, obsessive compulsive disorder, they tend to get less airtime, and consequently I think they're less well understood and managed by both the public and also clinicians. That's sort of the medical perspective. When I speak from the patient's perspective, however, I've been on the same receiving end of stigma from hospital staff when I was an inpatient. I unfortunately haven't always been well supported by some of my employers, some of my peers, and unfortunately along the way some psychiatrists. My illness and episodes of hospitalisation have been gossiped about in the medical community, and I'm pretty sure that this would have happened, if it would have happened in retrospect with a physical illness, it would have been handled far more professionally. Despite all the setbacks I've had along the way, tenacity and perseverance prevailed and allowed me to reach my career goals. Ultimately, the take-home message for me is that having a mental illness didn't affect my intelligence and it didn't affect my general competency as a doctor. I also want to mention the fact that accessing treatment through the mental health system wasn't always easy. So when I was first hospitalised for mania as a medical student, I found it really interesting that I had sort of 200 medical student peers and lecturers and professionals around me. And a lot of them either didn't identify there was a problem, or if they did, they weren't able to successfully raise the alarm or access relevant services to help me. And that sort of got me thinking that if a medical student going through a mental health crisis amongst medical colleagues and lecturers couldn't get the attention and help that they needed, imagine what someone in the wider community faces. I also think that having been a patient has allowed me to cultivate greater empathy for my own patients. I've seen firsthand how under-resourced and overcrowded our mental health sector is, particularly in the public section. Mental health, I'm sure most of you have heard, has a prevalence of 1 in 5 people affected each year. And I think that patients who suffer severe enough symptoms to warrant hospitalisation deserve better than the current system. Ultimately, I want to use my experiences to help vulnerable people who may not have the same knowledge and insight to advocate for themselves. So all of these sort of thoughts and ideas were swirling around in my head, and they eventuated in me contacting SANE Australia, which is a big government organisation for mental health along sort of the same tier of Beyond Blue. I became a volunteer with SANE, and around that time I was involved in a national video campaign 3 years ago that saw me sharing my story publicly for the first time. And I have to say the response was absolutely overwhelming. So within hours of sharing the ad on social media, it got thousands of hits. And to date, the video's been viewed over 50,000 times. I found that through that experience, it taught me that open disclosure has allowed for widespread dialogue about the issue. So I had numerous doctors, nurses, allied health staff, and just other people from all over Australia contacting me online, usually through Facebook. Some very emotional because they've never actually talked about this with anyone at the workplace before. A lot of them shared their stories with me for the first time and asked me questions. I've had 5 medical schools ask to use my video to help educate medical students in order to start changing the culture for the next generation of doctors. And for me, when I went through medical school, this stuff was unheard of. The fact that the message spread like wildfire suggests to me that this is a conversation that us as health professionals are ready to have. I think we're ready to begin the dialogue. We just need the catalysts. When I first became involved with the SANE video, I actually didn't set out to become a mental health advocate. But as it happens, when someone sort of speaks up, you sort of snowball and evolve into the position. I've learned through the process that I can't be everyone's saviour. It's really important, like for us at work with our patients, to establish boundaries. They're crucial in the space because it's very easy now to access each other's information and also be contacted. So for me, being a mental health advocate doesn't mean that I'm a Q&A service for strangers. And I actually think it would be irresponsible for me to offer unsolicited advice to people and also befriend them, even if I have the right intentions. So while it's a powerful way for us to connect by sharing stories, I don't think it's the sole basis for a friendship. And it's important to remember that when you look after people as well. So I've had a lot of people along the way comment to me, mainly that I'm brave for speaking so publicly about my experiences. But I really think that vulnerability is a necessity to destigmatise the taboo surrounding mental illness. I actually would like to strive for a time where open disclosure is so commonplace amongst us that it's not even considered a bravery to share our stories publicly. If none of us speak up about our experiences personally, how can we possibly hope to start a dialogue and affect any change in our culture? I want to help shed light on a topic that is generally seen as taboo in society and the medical community. And I've also seen firsthand that when someone sees someone else speak out and they're having a hard time, they might actually have the courage to reach out for help themselves. And I've seen direct examples of this. I think that ignorance breeds fear, and the only way to combat this is by speaking out and sharing our knowledge and experiences. If none of us speak up, nothing's going to change. I don't want to make this sound easy or flippant. I definitely had my doubts when I went public with my story. I remember I was an advanced trainee registrar. I was doing ICU as one of my rotations at Sunshine Hospital. I was worried how my influence would jeopardise my career. I didn't know how my consultants would handle it. I didn't know how people in the workplace would react to the video. Fortunately, I only received utmost respect and appraisal from my bosses and colleagues at the time. The CEO of the hospital network, which was Western, personally thanked me and encouraged me for doing it. And the hospital network then shared my video on the Facebook page. And then I've had a lot more doctors and nurses from that workplace opening up to me. And I remember they were people that I'd worked with the entire year, who my co-registrar said, I've got panic disorder. My resident said, I've got drug-induced psychosis. It was almost like an AA meeting where we'd all been living in silence together, and yet none of us had the courage to talk about our problem. And it doesn't mean that you go to work wearing a placard of what you've been through, but I just found it really interesting that until someone broke that initial ice, no one was really speaking up. So this sort of proves to me the concept that when we take the risk of exposing intimate parts of ourselves, displaying vulnerability, others tend to respond in like. This is the power of sharing and the power of vulnerability. Most people in mainstream society get a surprise when I tell them that people in the medical profession actually suffer more from mental illness than just mainstream society. In the last few years, as we all know, there's been numerous doctors and nurses who've taken their lives across Australia, including 4 psychiatric registrars. These are tragic statistics, and I don't think they're widely discussed enough. And they're not just statistics, they're our colleagues and they're our friends. Can you imagine if this was a medical disease like a novel virus killing young doctors? I'm pretty sure that a lethal illness like that would get a lot more publicity, traction, and research. Despite its high prevalence, mental illness is still not widely talked about amongst doctors. And I find this really ironic, given the long hours that we work, the high stress environment, all this talk about, finances, future planning, families, the trauma we face daily. There's a lot going on. For me, on a personal note, being in hospital was one of the most isolating experiences of my life. Every visitor I had was more than welcome, but there were quite a few people who stayed away. And I did find that very disappointing and hurtful. And you know what, maybe it's due to their fear, their ignorance, or they didn't know what to say. So whenever I give mental health talks, I always advise people not to stay away. Even if you don't know what to do, just keep being there for the person in whatever capacity you can. If they don't want company, they'll let you know. There really isn't a magic wand or a special formula for caring for someone with mental illness. What it requires is compassion and understanding. Basically, people suffering just want to know that you're there to support them. I appreciate that it can be confronting seeing a loved one going through a mental health crisis, but you have to remember that they're not themselves and they've actually got more chance coming through the other side with your support. So I think it's really time for us to start talking as a group and as a culture about mental illness. We do have a long way to go, but I'm not naive. Culture shifts always take time. But I think things are palpably changing. So Beyond Blue was an organisation that started back in 2000, and that dramatically changed the face of depression and got a lot of people talking about depression and their experiences with it. And since then, the number of projects that are sort of working to openly destigmatise and raise awareness about mental illness has exponentially increased. And there's a lot of organisations like Headspace, Sane, Mind Australia, and countless others. There is a momentum that's palpably increasing, but what I want to encourage and impart is that each and every one of us can actually add to this energy and contribute to the change in a multitude of ways. So how do we do that? Well, we're the doctors and medical staff of the future. So I really hope that you won't go through specifically what I went through, but chances are a lot of us are going to experience stress and or some degree of mental health issues on our travels. I think that we have a responsibility, actually a duty of care, to not only speak up, but to look after each other. I think it's crucial that we stop competing with one another and we learn to work alongside one another like we're human beings and not robots. Getting to know our colleagues as people rather than just co-workers in the hospital environment will actually make it easier to identify if they're not okay. And there's a lot of events like Are You OK Day and things like that. And I find them a little bit tokenistic. I find that we need to brush beyond just saying, how are you on a token day, and actually get to know each other on a more personal level, because we're not just doctors. We've got families, we've got social pressures, we've got personal stresses going on in our life. And I think that it's important that we're able to share that. Don't remain silent. It's crucial we start debriefing with each other regularly, like the nursing staff do. How often do we see something traumatic at work and then we don't debrief with one another? I know when I did ICU, we never had scheduled medical debriefing. Yet all the nursing staff do, and I don't understand why. We need to speak openly about our own difficulties and struggles, and that includes our clinical mistakes and our adverse events. I think that not admitting to our humanity only isolates us further. Being vulnerable in our profession is perceived to be a weakness, but ironically, I think it's our greatest strength. This year, during the final 6 months of my renal training, I actually took 2 days off. I'd worked 12 days in a row. I did 8 on calls, 6 of them were consecutive. I had accumulated fatigue and sleep deprivation. I wasn't having a mental health episode. I've actually been well for a number of years. And I took 2 days off. I've never done that before, but I thought no one's going to advocate for me if I burn out. There's that mentality of just keep working that we all adhere to. And those 2 days gave me the rest that I needed to have the strength to finish the rest of the week. And I'm glad that I did it. But it took 10 years to feel brave enough to take a mental health day. So what I want to impart is that staying healthy is more important than anything else. It's the adage of it's okay to not be okay. We all have things going on in our own life. We're human beings. We're allowed to be not at our 100% game all the time. I think the other thing that's important, which I've developed over time, is recognising signs and symptoms of unwellness and professional burnout, because they can be quite subtle, both within ourselves and within our colleagues. So burnout can include things like low mood, irritability, lack of energy, poor motivation, frustration. So they're subtle things that might creep up on you with time, but after you have a holiday, you realise it's all vanished. I think it's important to use support resources, and Aaron mentioned a couple before, if you're not okay or you need to debrief. So whoever is most comfortable for you, whether it's family, friends, organisations like Sane have fantastic online forums that are confidential and well-staffed at all times. I think something else I've learned is to schedule in wellness, which sounds absurd, but not treating, say, having a massage or doing exercise as being something additional or something you're rewarding yourself with. Actually scheduling that into your fortnight of work, even if it's half an hour, so that's treated with the same level of respect as your sessions or your patients or your assignments or whatever else you have to do. And like I mentioned before, things like Are You OK Day are good initiatives, but I want us to move beyond just asking those sorts of questions on one day a year. I think that our workplace needs to educate itself about mental health first aid. That includes recognising some of those signs and symptoms of mental ill health that I've mentioned, both in ourselves and our colleagues. And I hope that together as a cohort, we can change the culture of mental health in medicine and how it's perceived for future generations. Now, I didn't actually plan for talk for 20 minutes because I know it's hard to hold people's attention for 20 minutes, but I find that the Q&A part of my talk always tends to generate a lot of traction and actually helps people the most. So I just purposely wanted to leave a few minutes. If anyone's got questions or things they wanted to share, I'm an open book. I'm happy to answer anything. Thanks. The first one's always the hardest.
I'm not a doctor myself. I'm curious, when you mentioned that you had your first episode when you were studying medical school, how did that happen? Was it exam stress, or did you actually understood why it happened?
So when that episode happened, the diagnosis wasn't clear. Right. And I actually wasn't that stressed, to be honest. Right. Like there was nothing, I mean, you can always blame certain triggers and factors and contributing things. But it actually happened 4 weeks before my end of second year. So I actually had to repeat that semester the following year just to finish those last 4 weeks. But there was nothing. And that's the thing that in retrospect is most disturbing, is that I was very overtly not okay. And I was at medical school and nothing was done about it. And I actually ended up getting arrested and going to a public psych hospital, which hopefully, I like to think if it happened today, wouldn't go down the same track. But I have seen so many things go wrong with colleagues, friends, people in society who all come to me now because I'm like the token go-to person. And I still find that it's just as difficult for them to access help. If you look around, I don't want to place blame, but if you look around our hospital networks, it's really hard to tell someone you're not okay, to get a day off. If you asked 3/4 of registrars what would they do if a colleague was psychotic, I don't think that they would have immediate answers. I don't think there'd be an immediate framework of what to do. So we've got this really highly prevalent problem in a very type A personality group of people that have all the ingredients for difficulties, and we don't actually have the solution. And while I don't have the solution myself, I think we need to start talking about it. And I find that I get more traction by being vulnerable, sharing my story and just saying, well, look, this is what happened to me. How can we maybe help someone else so that we can, as a society and a community, actually find a solution? Yeah.
So you mentioned being aware of the signs of burnout in ourselves, but in others. How have you gone about talking to a colleague or maybe they might be showing some signs?
I think that being human does amazing things. So I'll give you an example. So now I'm the consultant, so I listen, as I'm sure we've all done, when the night shift people come in and then they're expected to present in front of everyone. And it's invariably a grilling process. Everyone feels terrible. They've just been awake for 10 to 12 hours. They've had 100 admissions, and suddenly people are like, well, why is the platelet count low? And what, and it's part of our culture, right? Like it's just, this breeds the next, anyway. And one guy, I just happened to notice, he looked really tired. He just looked really exhausted. And after he finished presenting, I just said, how are you feeling? You look a bit tired. And he just said, I feel dead inside. And I said, night shifts are tough, aren't they? I remember I used to have trouble sleeping during the day and it's really difficult. And I didn't offer him a solution, but we just talked as people about how the fact that he had a difficult night. Now, a consultant near me, who I won't mention, turned around and said, oh, no, it's fine. They do a week on, they get a week off. It's no problem. So I said, oh, actually, when I used to do night shift, I could only sleep 3 hours during the day. I really struggled with that. Staying up all night, making critical decisions, driving home at the end of that, for an hour. And it wasn't a standoff between me and that consultant, but you can see that if he had a problem, he'd be more likely to talk to me about it than this other consultant. And so I think part of it is being emotionally intelligent, which I think you can cultivate with time, but it's also just about being a person. It's like when we had clinical exams, there were some people in my group that used to hide cases from everyone, whereas other people would share them openly. And I confronted the people that hid the case and I said, what do you hope to gain? This isn't a competition. We actually all want to succeed together. We all want to be good physicians together. So I think it's about having that mentality of just being a person, approaching someone with an open dialogue, and you'll be surprised. Some people will actually tell you a lot of things going on. I've had people tell me they're suicidal just from starting dialogues like that. And even though it's not my intention to go around, I feel like we need to do this more, because there's a lot of people who are struggling in silence. And if you all open up to you and go, yeah, it's pretty stressful at the moment, isn't it? We've got an exam, we've got this, we've got that. You may not have a solution, but at least you can all bond together as health professionals. Or like with this private practice stuff, just sit down and go, oh, it's pretty scary. Like, I don't really know what I'm doing. And, you know, I don't really know where my consultancy job is going to be, rather than this bravado of, oh, I've got my future sorted. Do you know what I mean? It's that distinction between human and vulnerable at work versus being this type A robot that's got their whole future planned, which isn't realistic. And I think if you do the human approach, people will gravitate towards you, and then maybe we can direct them to the appropriate resources and help them. And you know what, a lot of us know what's going on. Like, and a lot of us know when we're not sleeping, or when we're anxious, or when we're having a bit of a more rough time, but it's whether we're in a safe enough space to talk about that. Does that answer your question?
Yeah, thank you. Any other questions?
Okay. Thanks.
Thank you very much, Dov. I think you've definitely been a much needed catalyst in those discussions that are happening more and more. I think I agree with you. I really kind of don't like the "are you okay" thing. It's very easy to say yes. But I know the other day I was just that really busy shift in ED. I was the mental health reg. And I think one of the consultants just noticed that I was like pretty tired. I was telling him how many hours I'd worked, and he just said, oh, and what are you doing to look after yourself? Which I thought was a really powerful question, because it made me stop and go home and think about what I was doing. And I actually changed some things that weekend and spent some time with friends and thought about, what were the things I needed to keep myself doing